In this study, my goal was to investigate whether the preoperative bone cavity was associated with the presence of stress shielding following MOPIC radial head arthroplasty. Stress shielding was defined as proximal radial neck resorptions observed on anteroposterior radiographs and classified as stage 2 or 3 according to the Chandelier classification. We included all patients over the age of 18 who underwent MOPIC radial head arthroplasty for a non-reconstructible Mason 3 fracture between 2002 and 2021 with a minimum follow-up of 6 months. The MOPIC implant is a monopolar device consisting of a purocarbon head and titanium neck and stem. This is an uncemented, auto-expanding and long-stemmed implant that achieved primary fixation. To investigate the impact of preoperative bone cavity on the onset of stress shielding, we conducted a retrospective multicenter review involving 4 European hospitals. We sought to assess if the medullary diameter to cortical width ratio, the canal flare index, and the canal fill of the proximal radius were associated with the presence of stress shielding after a MOPIC radial head arthroplasty. The first one was measured distal to the bicipital tuberosity on a preoperative axial CT scan and consisted in the medullary diameter to the cortical width ratio. The canal flare corresponding to the medullary diameter proximal to the bicipital tuberosity divided by the medullary diameter distal to this tuberosity. This ratio was based on Nobel's measurement for the hip joint. This author demonstrated that uncemented fixation is often the best choice for hip replacement when the proximal femur has a champagne-footed shape, which occurred when the canal flare index is greater than 4.7. And lastly, the canal fill is a ratio corresponding to the width of the prosthesis at the distal extent of the self-expanding screw, divided by the medullary diameter distal to the bicipital tuberosity. In fact, it represented the extent to which the implant fills the canal of the radial shaft. A total of 100 radial head arthroplasty in 64 women and 36 men with a mean age of 58 years were included. The stem was expanded for 82 patients, and at a mean follow-up of 4 years, the stress shielding was identified in 60 patients. Its presence was significantly associated with the medullary diameter to cortical width ratio and the expansion of the stem. The amount of the stress shielding was also significantly correlated with the expansion of the stem. So to conclude, the data here confirm that stress shielding is a common occurrence following MOPIC radial head arthroplasty. We found that preoperative proximal radius bone cavity may influence the onset of stress shielding after radial head arthroplasty, and the medullary diameter to the cortical width ratio was found to be independently associated with an increased risk of stress shielding. The auto-expansion of the MOPIC stem also significantly increased the risk of stress shielding and its extent. You can find the full text of our article in the JSES. Thank you for your attention.